Hey guys, my name is Lezli Braswell. I am a family doctor. I'm originally from Texas, but currently practicing in Georgia. We lived in Belton before moving here, and I grew up in Midland, Texas. So I was just going to tell you a little bit about my path toward becoming a doctor. So I went to high school in Midland, Texas. I graduated from Midland High School, and from there went on to college at Texas A&M. I graduated with a degree in biology, and in my senior year of college, I applied for medical school, and so there's a kind of a long process you have to go through. You have to take the MCAT, which is a test to get into medical school, kind of like an SAT, but just for medical school. So I took the MCAT, I guess my third year of college, and then started doing interviews at different medical schools around the state. Texas has a lot of really good medical schools. The University of Texas system has quite a few. Texas A&M has one, of course, Baylor, Texas Tech. So there's lots of options for medical schools. I was accepted at the University of Texas Health Science Center in San Antonio, so I went there to start medical school. My first year of medical school, I met a nice guy who I ended up marrying my second year of medical school, and he's also, of course, a doctor since we met in medical school. When we finished medical school, which takes 4 years, then we both did our residency. So when you finish medical school after 4 years, you're a doctor, but then you have to go train to be a specific kind of doctor. So that's where residency comes in, and that's where you learn your specialty. So I trained in family medicine. That's a 3-year residency. I did that in downtown San Antonio, and then my husband trained in surgery, which is a 5-year residency. So when we finished all of that, then we had our specialty training, and then you take some tests called a board exam, and once you pass your boards, then you're considered a board certified doctor in whatever your specialty is, whether that's family practice, surgery, pulmonology, cardiology, all those sorts of things. So I've done all kinds of different types of work since I've been a family doctor. My first job was doing what they call corporate medicine, where I worked in a clinic that was in a building, like a big corporate building. And so the people that worked in that building could just come downstairs and see me at the clinic that was there. That was a really nice job. And then after that, let's see, I worked some in an emergency room and did that for several years when my kids were little. I worked at an Army hospital clinic for a little while. When we lived in New York for a few years, when we were there, I worked at a clinic for patients who had developmental disabilities. So most of my patients there had some kind of a disability like cerebral palsy or different kinds of intellectual disabilities, and I loved that job. That was a lot of fun, and I learned a lot. When we moved back to Texas, I did sort of just run-of-the-mill family practice, and that's what I'm doing again now. So I work in a clinic. I hardly ever go to the hospital. So I just mostly see patients who come to my clinic. The main things that I treat are like diabetes, high blood pressure, depression, coughs and colds whenever people get sick. I'm the kind of doctor that you would come to see for that. I do just routine checkups, make sure you've got all your immunizations and things like that. So that's kind of what I do. I really enjoy my job. I like that I get to talk to people. I like that as a family doctor, a lot of times I really do get to see a whole family. You know, I might take care of the kids and their parents and their grandparents and their aunts and their uncles, and I start to learn some of those family dynamics, but it helps me, I think, be a better doctor once I kind of have a little insight into the family, and I just really enjoy kind of those relationships. The hardest part of my job is this, which is the medical record, the electronic record. So although a lot of good stuff comes from having information in one place, it's just a lot of typing, and that really wasn't my goal when I became a doctor, to sit on a computer all day and have to type all my notes. So just the having to write everything down. In medicine, they say if you didn't write it down, you didn't do it. So you have to make sure that everything you talked about with a patient, that you put in your notes, so that you can prove that you did it. And so, although it's important, sometimes it just gets old. So anyway, I hope that gives you a little insight into what it's like going through school in order to be a doctor.